A swallowing disorder, the fancy word that us medical professionals use, is dysphasia. So several things can cause dysphasia. Anything from disease process, such as Parkinson's or ALS, or even respiratory disease, such as COPD, can cause swallowing disorders. And all the way from simple things that you would think of, like being intubated for an easy surgery. An intubation can cause a dysphagia after the fact. Head and neck cancer. There are several facets that can cause swallowing disorders. I think the most common one tends to be with strokes, or as people get older, dementia. People might start noticing that they are coughing throughout their meals more. Whenever they're eating or drinking, they're noticing that they have that gurgly, underwater sounding voice. Also, another thing that can give you a hint that maybe your body's telling you, hey, we have a problem here, is weight loss, or not consuming as much food as you would like to throughout a meal, which can lead to becoming malnourished or dehydrated. So as a speech pathologist, we have several treatment approaches that we will tailor to exactly whatever your disorder is. Like I said, there are lots of things that can go wrong in this seemingly simple response. So traditionally, we would first have you do some kind of formal swallowing test, and there are two ones that are both considered a gold standard that we do here at the hospital. The first one is a fiber optic endoscopic eval of swallowing. We might call it a FEES for short, and that involves us just putting a tiny camera with a light into your nose, down to your throat, so we can see what's going on. Then we'll give you food. There's another test that's an X-ray that will be performed in radiology that also shows exactly what's going wrong with your swallowing. Now, after we get those results, we can actually plan a treatment plan based around what exactly your deficit is. So that might look like a swallowing exercise program, just like you would think of for physical therapy. We do exercises for those swallowing muscles. Also, we'll do electric stimulation to your throat muscles to help get them stronger and to help produce a muscle reaction. We can do feedback, where people can actually look at a screen and show how hard or how good their muscles are working. That provides some feedback. I do some manual or massage therapy. If you think of a muscle that's too tight in your shoulder that doesn't want to work, that's the same with your tiny little swallowing muscles. So there is quite an array of things that we can do. Well, depending on the disorder, I'll start with my true love is head and neck cancer patients. So if I get somebody who had radiation or surgery to their head and neck, their projected course of therapy might be quite a bit longer because they have a lot of changes within their tissue through the radiation and surgery. Whereas if someone just comes with some COPD, some coughing, a newer dysphagia onset, we can generally get these people feeling back to normal and eating and swallowing safely within 2 months or so.